we're not talking about a cure. We're talking about mobilizing a natural healing process that we assume and that we know is present in the child. Just as if I cut my finger, immediately the finger begins to heal. How does that happen? I can't explain it. I don't know how it happens. And yet, I truly know at some level because it's working. Just as I know how to beat my heart, how to breathe my lungs, but I can't explain that. But somehow I do know how to do all these things. The body, the mind, and the spirit want to be whole. And what we're talking about is creating an environment that will nourish a natural process. Play will begin that process. It cannot cure what has been done in the past. Nothing can undo or erase what has been done in the past. We're only talking about the present moment, but that is the only moment we have. That said, once a child is invited to come out of the dark corner of their trauma and of their memory, that process must continue. So it is essential in any intervention that the people doing the intervention engage not only the child, but the family and the external perimeter of the child's life. If you change the shape of a piece of a puzzle, even though you think you've done a pretty good job and the shape now is bigger and stronger and so forth, and try to insert that piece back into the puzzle from which it came, it will not fit any longer. And the only thing that will happen, especially if the frame of the puzzle is rigid, is that that piece will now be popped out of the puzzle, or the piece will be banged back into the original shape. That's why it's so important whenever working with children to engage the entire interpersonal context. It's a great responsibility. But a child cannot be treated separate from the context in which they are growing. Just as a plant that is not doing well cannot just be plucked up and treated and then put back. We have to be wiser about our approach.